So hello everyone. Today I will be explaining on how to care for demanding patients. Why are some patients demanding? Because for some of them, being demanding is a coping behavior when they are frustrated, and usually people who are very demanding feels that they have lost control. Try to identify the triggers of the demanding behavior. Patients are more likely to be demanding when they are feeling hungry, or they think that their surrounding is very noisy, or they are feeling very ill, very tired, and that's why they have a very demanding behavior to the nursing. It is important to us to figure out what causes the demanding behavior, so we can easily solve the problem, and we can also easily calm the patient's demanding behavior. The next tip is to show that you care for the patient, but also to control your emotion. So if the patient is, let's say, they're very demanding, they don't want the drugs that are given by the let's say the nurse, and then the nurse will say, if you don't take these drugs, you will die. We should control our emotions. We should not lash out to our patient. If we explain something, we should explain it properly on why, and we should explain it to them gently. We should say, this drug will help you to decrease your pain. It will help you to become more healthy. Next is, do not take the patient's demands personally, because you as a medical care worker, you know better than your patient about the patient's health status. So you can explain on why you are doing this, and the reason that you are doing this is for the patient's own good. Next is to support the patient by being a good listener. So when your non-verbal communication cues, which is how you the way you listen, the way you make eye contact with your patient when they're talking, the way you react to their words, this shows that you are listening to what they say, and this can increase their trust on you. Next, I will be demonstrating several tactics on how to successfully caring for demanding patients.
I want more protein in my diet. I cannot survive with the little protein.
Okay, miss. I understand your complaints, and I will report it to my supervisor, and we will see what he decides to do with it. Okay? I will come back to you.
Sure. I don't like the other nurse. She was so aggressive with the IV. Look, there's bruises.
On behalf of the hospital staff, we are very sorry of this issue, miss, and I will report it to my supervisor, and he will take action for this issue. Okay?
It's way too tight. I don't want it. Get me another nurse.
Okay, I will search for another nurse who is available. Okay?
Okay.
You call for me, miss?
Yes.
Hmm?
Why is my apple not cut into stars? Why is it just slices?
Oh, because it's easier for you to consume it that way.